Hello, this is Dr. Simmons from the Chiropractic and Kinesiology Center in Charlotte, North Carolina. Today we're going to talk about some spinal anatomy. Now this is a plastic model of the spine. If you look from the front, what we expect to see is that this spine is nice and straight. So when we look from the front, we don't expect to see any curves. If we do see curves, like for example, we'll make a curve there in the mid-back, we would call that a scoliosis. Now this can happen at any area of the spine, so we can have a scoliosis even down in the low back or even in the neck area. A normal spine we expect to see no curves and expect to see this straight. Now if we look from the side, we'll notice that there are 4 curves. We have one in the neck, one in the mid-back, one in the low back, and one in the tailbone. Now these are basically 2 matching pair of curves. So you see the neck curve matches the low back curve, and the mid-back curve actually matches the tailbone curve. Now if we look from the front again, we will see spinal vertebra or spinal segments. And you'll see that these are the big white pieces of bone here. In between those, we will see these thin areas called disc spaces. Now you've probably heard people talk about bulging discs. Now I'll show you what that looks like. This is an example of a bulging disc. You see how it's taking up space in between the segments and moving backwards? Now what it can do when it does that is actually put pressure on these yellow areas here, and this is an example of a spinal nerve. So wherever this goes to, we'll be getting pressure from this bulge. And you'll see that the spinal nerves run all the way up the spine, and they come out at different areas, but you'll see they come out in between the segments and behind the discs. Now you'll notice these big white areas here. These are just areas for muscle attachment. So the muscles attach here and move the bones around, and that's what helps your body move. The other areas that we have are your pelvis. So we have one here, and the other half is here. And you'll notice that they are movable. These are basically called your hip bones commonly. And you'll see that your legs actually attach in here. So your actual leg bone will actually attach into the hip here and rotate around in this socket. Then we look at the top, we'll see that this basically is just the bottom of the skull. So this is just to show you that basically your head and this bottom of the skull actually sits on top of the spine. So this is where your head will be moving up and down and turning sideways, and the body will be using these muscle attachments to move the spine and your body around. That is basically an introduction to spinal anatomy of the spine. So I hope you found some useful information here today. And as we always say, make good choices and have a great day.